Hello and welcome to Dialogue. China has announced 10 new measures which will further relax COVID restrictions in the country, including allowing home quarantine and largely scrapping the health QR code and most testing. What brought about the change? What are the new measures? And does this mean China is moving away from its zero COVID policy and towards a living with COVID approach? To discuss these issues and more, I'm glad to be joined by Professor Wu Zhiwei, Director for the Center for Public Health Research at the Medical School of Nanjing University, and Li Mok, Senior Research Fellow at the Center for China and Globalization. Also from CGT is a non-resident Senior Fellow, Mario Cavallo. That's our topic. I'm Xu Qinduo. Welcome to the discussion, gentlemen. We know China has adopted 20 new measures to relax these COVID-19 restrictions. And then on Wednesday, it introduced the latest 10 new measures to further loosen the restrictions. Before we touch upon the latest new measures, we will start with some introduction probably about the general situation in China, because you are from different cities, and Mario in eastern part of China, Andy is based in Beijing, and Dr. Wu is in Nanjing, southern part of China. We'll start with Mario. How is the situation like in Shenyang?
Thank you, Qinduo. I'm going to say on our panel this evening, I definitely represent the most conservative approach. Liaoning and Shenyang has that reputation for the longest and strictest set of rules going around, but I'm happy to say they're getting with the program here in Shenyang as well. We are definitely loosening up. We're definitely, but they're being very careful. You know, it's like this optimized targeting, right? Optimized, more isolated and targeted approach. But the main thing, for example, my boy is, the kids are still in online school this week until Monday, whereas a lot of other schools have already gone back on. So I'm the conservative one today, but it's been okay here in Shenyang.
Dr. Wu, we know that some of the cities like Hangzhou or in that part or in southern China like Guangzhou, they are at the forefront in terms of loosening the restrictions and getting back to normal. What the situation is like in Nanjing?
Well, Mario represents the conservative part of China. I actually representing the middle part, basically between the conservative and the open-minded. 2 days ago, when we heard that in some southern cities they're starting, abandon this nucleic acid testing and the so-called locality code screening, whatever. We were wondering when the Nanjing facility would be basically opening up. So, but yesterday when I stepped out of the university and went to the subway station, what I noticed is that the lines for nucleic acid testing are disappearing, and also the subway station no longer requiring the nucleic acid testing results. So this is a very encouraging. People are really happy today. Is that when I met my friends and colleagues, they say, well, now we are at the end of the tunnel. We see the lights.
Yeah, end of the tunnel, and much easier to get around. Andy, we know Beijing is the political center of China, so are things also getting easier for people to move around?
Well, I think, Qinduo, certainly over the last few years, life on the ground here in this COVID stage era we're in has changed a lot. So at the beginning, of course, there were very strict lockdowns and very, very broad lockdowns. Now, step by step, it's become more targeted. And I'll give you an example. So in the community that I live in, it was locked down because of just the overall condition. Recently, we had the whole community, which is about 20, 30 buildings, locked down. Now, about 2 weeks ago, we had a positive case in our building, and we were locked down for several days. Lately, there was a positive case, and we were only required for testing, and we're not locked down. And I think what this reflects, and I'm sure we'll talk about this, is a couple things. One, of course, is the evolving strains of COVID becoming less deadly. But I think also the government's confidence in the ability to treat COVID as well. So we've seen dramatic advances in experience and methodologies ranging from Western medicine to traditional Chinese medicine to just developing the systems to make sure that people, if they are severely ill, can be quickly and effectively treated. So I think that certainly the trend is very, very positive. I think the mood in Beijing is much more upbeat. There's even a certain amount of excitement, I would say, because we can see, as Professor Wu said, the light at the end of the tunnel.
Well, Dr. Wu, now the 10 new measures, the latest steps taken by the Chinese government, further loosening those measures over there. So what do you think are the key steps in probably restoring or managing? We know it's not a complete abandoning the measures. It's restoring the normal life and also getting back to the normal life. But still, there are some measures there. But some measures obviously are producing probably profoundly change of things on the ground.
Yeah, I think there are three aspects which you can see from the new 10 measures in the intervention and prevention of the COVID-19. One is the precision control and intervention, which basically means, as just Andy mentioned, that you no longer lock down the entire community and no longer lock down the entire building. So what you need to do is that if you identify that positive case, then basically you do a minimal interruption of people's life by either lock down a small unit or a floor. That's what yesterday what happened. I heard from a friend in Suzhou, in the building where I actually sometimes live, is that one positive case was identified that they locked down the floor instead of the whole building. So that by doing this, you basically give a minimal interruption, disrupting people's life. I think it's very critical. That's the key of this precision control. The second is that the government actually is shifting towards the elderly population and the people who have a basic medical conditions. I think those are the groups who are highly vulnerable to even Omicron, which is much less pathogenic, but still can pose serious problems in terms of severe diseases and even death in those people who have some basic medical issues, and those people who do not have vaccination. The third is the government encouraging to move to enhance the vaccination campaign to promote particularly in the elderly population and the people who have certain medical conditions, to let them to understand that the vaccine is safe, and basically providing medical consultation, what kind of side effect would be. I think it's very critical because in the age over 80, the vaccination rates are still quite low. It's about 65%. I think we still have a long way to go to increase the vaccination to this population, because we know that the vaccination in the previous cases, like in Hong Kong's outbreak, it has been demonstrated that China's vaccines are providing very effective protection, particularly for those elderly people, significantly reduce their death rates. So that's what I can see from this 10 new measurements.
Well, also, Mario, obviously, there, if you look at the measures, seems that there's much less intervention, or I would say less inconvenience to people. Even when they are tested positive, they will be required, to quarantine in their own homes, unless they volunteer to go to the centralized infrastructure over there. So it's much easier for people. I mean, whether you are close contact or you're tested positive, it's much easier to carry on your life.
That's right. And one of the main factors that I noticed again and again, I spent the last 10 days or so making what seemed to me a very obvious comparison, which would to build our confidence that it was okay to be able to start opening up, which was to say, go back to February 2022, Hong Kong had a huge outbreak and there was over 9,000 deaths, and it was not pretty. It was very difficult. And then 6 months later, or a few months later, around June or so, Taiwan made the decision to open up. And in the subsequent 6 months, Qinduo, they had something over 18,000 deaths. It was parabolic on a chart. This was very scary. But then look at what happened. The third case I want to compare was, look at what happened when we had that very severe outbreak in Shanghai. Now, that was management-wise, that was a debacle. That was very difficult, and we all wish that hadn't happened. However, the fact is, it was a widespread outbreak, but what was different? Very, very low death rate. And also, I remember 90% positive cases they were seeing positive cases were 90% asymptomatic and only 10% symptomatic. And then obviously amongst those 10%, some were severe, but a very low death rate. So China has been spending 3 years, Beijing's been spending 3 years evaluating and assessing this evolving pandemic and the evolving variants, and finally saw this result in Shanghai. Most recently, Chongqing with many thousands of cases, Guangzhou with many thousands of cases, confirming Shanghai. Very, very low death rate. So the government finally could say, we can now pivot from this 100% focus on protecting health. Now, and fortunately we can, because the people are getting frustrated, now we can pivot back to a more balanced situation here in the country.
Mm-hmm. Andy, if you look at the 10 new measures, it seems like the priorities are shifting to the senior people, in particular those 80 and above, in terms of vaccination, and also because there will be much less PCR test or QR screening. So that you do see the changes, and you mentioned about China is better prepared in terms of treating COVID patients. That kind of infrastructure of facilities, the government is more confident. Probably that's part of the reason why now we are opening.
Absolutely, and we have to recognize this is, of course, a public health crisis. So the COVID pandemic all around the world was a public health crisis, but it also is a policy challenge and a political challenge as well, because there are real costs. There were economic costs. There still are economic costs. People had to endure quite a lot. So I think it's a complex issue. And one of the key tasks ahead, as was announced, is increasing vaccination amongst the elderly, especially the old. And I think there's two factors here. I mean, one is that they tend to not get out as much, so reducing the opportunities to get infected, but also the communication is very, very important, as we've seen mentioned in the press conference in multiple messages from the government that the vaccines available are safe. They really should be taken. And at the same time, the government is responding, and I hesitate to use the word pivot because it sounds somewhat arbitrary. I think that, again, this kind of complex challenge requires balancing public health. It requires balancing economic impact, and it also requires balancing public sentiment as well. And I think there's a bit of a misperception in the West that the Chinese government wants to take these very strict measures. And I think nothing could be further from the truth. And now, because the virus has evolved, thankfully, to be less deadly, so of course it would make sense for the government to take these measures while doing more to protect the elderly.
Mm-hmm. Dr. Wu, over the past couple of years, in particular the past year, I would say, PCR testing is one important feature of our life here in China, constant testing. But now, basically, except for a few areas like primary schools, senior elderly care facilities, for example, they still require the testing result. Otherwise, the public facilities like subways you mentioned, no requirement for the green QR code anymore. But if that's the case, are we still going to track the virus, the Omicron, and are we sure that Omicron is less deadly? Is it because of vaccination, or is it by itself it's become much milder?
Well, the Omicron is definitely not as pathogenic as the previous ones. This is very clear. There is plenty of scientific evidence. And this also fits to the natural evolution of a virus when the virus in the population keep circulating. There are publications and clinical evidence as well. I think what the reason for the virus becoming weakened, which could be multifaceted. One is that the virus has been circulating for a long time. Second is that there are large population receiving vaccination. The immune pressure would drive the virus to becoming mutated, to become more adaptable to the human environment. So this is basically how a virus becoming adapted in the human environment by becoming less deadly and more transmissible. So I think it's a good news. There is no question. For the nucleic acid testing, I completely supporting to remove this nucleic acid testing because many of the testing sites are kind of makeshift sites which are not safe. When you see huge crowds lining up to take the test, this is the opportunity for the virus to transmit. I suspect that in the past, this probably is an incubating field for people to get the virus. So, but it doesn't say that we completely abandon monitoring the virus. That's why the government also indicates that the antigen test should be utilized individually. You can use it at your home in certain facilities. And we know that the Chinese antigen testing kits are actually quite effective. There is certain comparisons indicating that its accuracy rate is above 90% as compared to PCR testing. So this can serve the purpose to track the virus. The other thing is that, as we say, that your health is basically your own responsibility. So once you have the antigen testing kit in hand, if you test yourself or find out that you're positive, you can do your home quarantine. Because most people have no symptoms. I think that would help to reduce the public health system the burden, and also in a way also to prevent the viral transmission. I think this is the perfect solution at a low cost.
Mm-hmm. Well, Dr. Wei, of course, the among the 10 new measures, one is about the PCR testing. We know there's much reduced testing over there. For those testing positive with mild or with asymptomatic symptoms, they are advised to stay at home for a few days unless they are voluntary to go to the centralized places, for quarantine. So is that also a consideration, basically, to reduce any possible burden on the medical facilities, so we can better handle probably the expected the rise of infection cases?
Well, that definitely would help to reduce the burden to the health facilities, and also avoid overwhelming the medical facility, because most of the people have no symptoms. And I mean, if they don't have symptoms, why you need to take them into hospitals? So this is very clear, and also unlikely that those people will develop some severe diseases. We have plenty of clinical data and evidence supporting this. So that's why tracking the positive cases are no longer the primary indicator of the disease. So that's why we need to focus on the severe cases and the death. Those are the more relevant and critical factors we need to look for.
Well, Dr. Obviously, we are expecting an outbreak or say the rise in terms of the number of cases, and also probably the increasing demand for public services or medical services at a certain point of time. It seems to be the experience for societies when they try to open from the COVID-19. So, do you think the Chinese health infrastructure, are we ready for this?
I would think so. There are two things. One is that if you take Hong Kong's outbreak as an example, okay, most of the people who became sick, and eventually some of them died, basically those elderly people without the vaccination. If you look at even the elderly people with vaccination, the death rate is significantly lower, and the severe cases are also significantly reduced. So if that model is correct, then if you look at the Chinese population now, the overall vaccination rates is complete vaccination rates above 90%. And if our focus is on elderly people, then we should be able to deal with, and we don't expect that there are large number of severe cases and deaths. So the current medical facility should be able to deal with the situation.
Mario, obviously, these with this adjustment of the policies here, and it also requires probably adjustment of individuals in terms of psychology, like better understanding of the new strain. Omicron is not as obviously it's much milder than the previous strain, and people probably need more information about the symptoms and how they can take care of themselves. So you think the public is ready in terms of this kind of shift?
In terms of whether or not the public is ready for the shift, and by the way, I agree with Andy. I use that word pivot. This is not the Fed, and we're not Jerome Powell. Pivot's not the right word. It's been a gradual shift, and that's the right word to describe it. And in terms of the public being part of that shift, my answer is yes. And why? Because we've had plenty of time along the way. The public is very aware of what the issues are. Nothing has been hidden from them. They've been able to get as much information as they need to understand that they also have to be responsible for their own protecting their own health, right? So, for example, I think as a population of people, 1.4 billion people in China now know not to use their fingertips to push anything, right? We've all developed new habits. We don't push elevator buttons or push doors with our fingertips anymore. I never touch anything when I'm pushing something with my fingertips, and it's a brand new habit. Well, guess what? It's a really good habit. And so I want to take that as an example, and I want to multiply it because we are in a more traditional conservative society, I'll say it that way, overall, compared to, say, in Western neoliberal democracies. And what does that mean? The people are more willing to pay attention to those details. They're less willing to have this freewheeling kind of neoliberal attitude, which says, the virus, I'm not worried about that. Forget about that. I don't care about that. I don't need to wear a mask. No. You'll find very few people in China with that kind of thinking. So even now, when you say, there's no mask requirements, there's no testing requirements, well, guess what? Common sense prevails. And the vast majority of Chinese people are still going to be very willing to be responsible for their own health. And when I get in a crowded room, guess what? I'm thinking about putting on a mask, and I don't need anyone to badger me to do that. And I think that represents the majority of people here. The awareness is there. I was watching the press conference before the show, the live press conference that started at 3, and they talked about this, how there's an even bigger push for this health literacy. This is what they called it, the health literacy of the public. It's already quite high, and they're going to keep pushing on that. We all have to be responsible, and the shift is moving now from the government to the households to be responsible. I think we're in very good shape in that respect.
Well, Andy, obviously, if you look at the different regions or provinces or cities in China, the situations, they are different. For example, in Guangzhou, they have been basically largely open, and Hangzhou for a week, and there's no that kind of, we have not seen that kind of fear or worry oh, there will be, say, overcrowdedness in the hospitals, or this probably overburdening of the medical facilities. This is not happening. And I think, but still, for some people, there are still kind of worries or concerns, like whether I'm infected, or what should I do if I'm getting infected? It's still kind of a concern. So education probably is still necessary.
Well, I think education is always necessary. And again, this is why I think the role of government in terms of communication is so important. And I think there's a couple factors at work here, it seemed to us. So first of all, China is a big, diverse place. So not just geographically, climatically, but also people's thinking, etc. So I think that, these notions that China is this monolithic, completely autocratic place is somewhat distorted in that local leaders have a lot of responsibility and discretion to adapt central policies to their local conditions. And this has been a feature of China, not just since '49, but for thousands of years. So I think that's important to recognize. But at the same time, yes, I think I completely agree with Mario that Chinese people tend to be perhaps a bit more cautious. Just from my friends, the people around me are saying exactly the same thing, that, even though things are opening up, we can move around much more, but there's still a certain sense of caution. And I think it'll take a little bit of time for people's confidence to come back. And communication here is very important for that as well. So again, I think that this is a complex challenge that requires a complex solution, not just healthcare solutions, but communication solutions as well.
And obviously, this is exciting news for the economy. For example, the Chinese stock market have seen the strong performance of the past couple of days. With the news, loosening restrictions, and some of the investment bank are predicting a much better future performance of the Chinese equities. First time in 2 years. What do you make of that?
Well, certainly, I think that this has been a difficult challenge economically, not just for publicly listed companies, but private businesses and individuals as well. So I think that we can move beyond these strict measures is certainly very, very welcome news. And certainly equity markets look ahead. So I think it's not surprising that there's rises in the prices of publicly traded companies, because again, they're looking at future earnings, not necessarily earnings today. And this is a very, very positive signal.
Mm-hmm. And what do you see as the prospect for the Chinese economy in 2023? Or what kind of policies do we need probably to further strengthen the confidence of the economy?
Certainly, China is getting its own house in order economically, moving past this era of severe COVID restrictions. We see some other policy measures as well that I think are positive in the real estate sector. There's other secular growth drivers for China as well. Transition to a more sustainable economy from an environmental perspective, so opportunities for electric vehicles, other types of longer term drivers that I think are positive. But again, we definitely should not discount some of these external factors as well. So let's wait and see. But I am optimistic. I am optimistic, but I think we also have to wait and see how some of these other factors play out.
Well, on that note, we come to the end of today's discussion. Many thanks to our guests. You can also find us on the CGTN app on YouTube. I'm Xu Qinduo. Thanks for being with us. See you next time.